Awesome. No one else on the call. Great. Good morning, everyone. Thanks for joining the subcommittee for Community Advisory Board on Public Safety. I guess we'll do roll call and introduction. So Justin Van Zerber, Chair. I'm in West County.
Oh, Brenda Lee, West County, Vice Chair.
Tracy Simpson, Central County, member of the subcommittee.
Yeah, awesome. Next up is public comment for anything that's not on the agenda, but under the jurisdiction of the subcommittee. Announcements or anything to bring up? No one on the call. Gariana, anything from ORJ?
No. Oh, yes. So we are compiling a progress up to date for the recommendations. We were not able to have it for this subcommittee, but we're going to try to provide it by the April general CAB meeting.
Awesome. And that's the recommendations from last year or like several years back?
I don't know how far she went back, but I think she's trying to like put together a few years of recommendation.
Awesome. I thought we had to do that. So that's wonderful.
Oh, yeah.
Great.
I was going through that as well.
Yeah. Awesome.
Okay, great.
Next is looking at the record of action from last subcommittee meeting, if there's anything needs to be changed, or if we can have a motion to approve.
I move to approve the minutes from the last of the budget subcommittee.
I second it.
And I agree. We should be
Uh,
all
all-
set, right?
Yeah, all in favor?
Aye.
Aye.
Any objections? Any recusals? Motion carries.
Awesome. Next up on this list is to discuss the policy and budget work plan and priorities for 2025. In the agenda packet is the work plan from 2024, but each subcommittee member has a printout from Gariana of a draft that I put together for 2025 based on the discussion that we had last month. So in the agenda, you can kind of see what we had discussed about last month around it being vague and not really having, it was really kind of broad strokes and not having tangible outcomes that we could point to. And so I took that recommendation and you'll see in the 2025 plan, it's really kind of nuts and bolts, we should do this and we expect this will happen. We should do this and we expect this to happen. So since you guys have not seen this draft, I'll just give you a couple minutes to review it and then we can have any feedback or revisions or changes or any guidance that you think we should incorporate. Morning, Travers.
Morning.
And Ariana, you're not able to show the 2025.
No,
Because it wasn't-
sorry. I didn't include it in the agenda, so I can't show it to the public.
No worries. Year over year.
I know year. I knew the first part was year. I didn't know. Okay.
Yeah. Right. So looking at that, how does it Land, how does it feel? Anything that stands out wild and crazy, or anything that you think should be added, changed? Initial thoughts?
I just have a question
Yeah.
about the review quarterly financial reporting in it during the CCP meetings.
Yeah.
So when I was doing my reading, my homework for this meeting, I learned that departments submit annual reports. And then there was a request from CAB to have a semi-annual report, which is supposed to come out in March. So there's something in addition to the annual and semi-annual, because it says quarterly.
Yeah, I believe that they report every quarter with how much they've expended. So they made a plan to CCP
Mhm.
in advance of the budget being released, saying we're gonna spend X number of dollars.
Right, but that they report annually and semi-annually.
And
Here
quarterly.
it's, oh, and quarterly. Okay,
Yeah, I
didn't-
don't know if the quarterly is so, it's not like, I don't think there's a budget narrative, but there is expenditure. So
Okay.
it'll show we've spent 17% versus 30%, et cetera.
Okay,
Do we see that? I remember seeing something like that in one of our meetings where, maybe it was at a CCP meeting that I went to, where they were discussing, how much had been spent. And, but I don't know if it was quarterly or annually, but I do remember them discussing the budget and how much had been expended, versus what was left over.
no, I get that they do that, but
Yeah.
just in my reading, I just saw that it happens annually, and then there was
Yes,
a
yeah.
request to have it happens
Did CAB-
semi-annually, like to have it in March, but they didn't do it in 2020 after the initial request came, and then they said, well, we hope this was just a one-time thing and we will do it moving forward.
Okay.
So I don't know if last March they presented this information or if they've done it already this year in March, but
Yeah, Gariana, do you have an update on that? Do you know if CCP got a shared expenditures by quarter?
I'm not sure, but I know we included the budget documents in this packet, but I don't know if it's bi-monthly or not, but I know it's one of the agenda items.
That's the budget narrative for 24-25, right?
Correct.
Okay.
okay.
Yeah, so I think this is what I was alluding to. So they do this on an annual basis where it's really detailed.
Okay,
And then
Right.
they'll say this is how much we've spent down.
okay. I guess the question that I had
Yeah.
was that it didn't happen in March. They were asking for it to happen in
Uh-huh.
March and I think December. But the March one wasn't occurring, so I don't know if that's something that happens already.
Who requested it? Was CAB? Did
It was from
request?
CAB.
And did they agree to because a lot of times we ask for things and they'll just.
Well, the
say-
county agreed to
They-
it, and
yeah.
again, in the first year, it didn't happen, so they were saying, well, we hope this is just a one-off, and moving forward, it will happen.
So we need to know if they did it this,
Yeah, that's what I was trying to say, if it,
so it'd be this month, be it March, you said March?
it says March, that's what the document said, but I don't know, I don't know, this is just what I'm reading, so
Yeah.
I don't
Oh,
know,
it's helpful.
actually in practice versus
Right.
what
What
they
they
talking light.
Yeah, so
So
we
I-
need to,
And I think that's part of what we're trying to do is understand what recommendations have been put into practice and what are still
Right.
out there
Out
that
there,
haven't.
yeah.
So that's a great flag. Other questions
Okay.
like that arose? So do you think maybe following up on this, we edit it to say, another bullet would be ensure CCP is reporting on a quarterly basis.
Right.
Other things that stood out or questions that,
I think one thing that I do like about this, it has invite CBOs and the community members to come and participate. Again, in doing some of my research, it seems like we may have submitted a survey to the CBOs in the past,
Mhm.
and there was a very low response rate. So
right.
actually inviting them in and including them in this space may be more helpful than just sending them a paper document.
Yeah.
So I thought that was a good addition.
Awesome.
We did invite them in.
Oh,
A lot of the committees that I was on, we did, because
Okay.
we had Men and Women in Action, we've had the lady out in Antioch, I'm not sure. But the point And they did mention, and Rubicon, because Rubicon was very adamant on saying, you know, this is what we're asking and this is what we need. And I'm not sure what the result was, but I do recall them asking. So I know we did have a meeting, I don't know if it was OC, EC, or if it was CAB, but we did have this meeting discussing, you know, they were telling us the gaps where they felt. And so I'm just not sure which committee I was on, but I know we discussed it and they were very vocal. I remember Rubicon and what's the other group? There was another group, Men and Women of Action. Right.
Color?
No, I think it was of Action.
Okay.
And I think I've seen it in here again.
Okay.
One of our members works with them and I can't think of her name. Rena
Rena Moore?
Moore,
Or
maybe.
Hurley.
One of the Renas.
It's Hurley.
Okay. And is it Men and Women of Action? What is it exactly?
Men and Women of Purpose.
Of
Purpose, there you go.
Men and Women. Okay, yeah, okay.
Super close.
Yeah, they did. So, you know, and they were in some of the budget things. So I don't understand why they were, but they did mention, you know, the funding. Because we were discussing the 15 million and they might have, you know, put in a request at that time. Nicole, maybe Nicole remembers.
I
Yeah.
can,
Good
I
morning,
sure do.
Nicole.
What was, hi, I came to support you, Justin. Hearts. What was the
How
question?
are ya?
I am doing amazing. I was determined to make one of the meetings. I'm sorry, what was one of the questions? I'm pretty sure I know. I heard
We
Men
were
and Women of Purpose.
Yeah, we were discussing, you don't have.
She doesn't have access to
Okay,
that.
I'm-
So we have a draft 2025 work plan, but it wasn't included in the agenda packet. So Ariana's not able to share it publicly. And one of the components that we are discussing is inviting CBOs to share about their continued gaps like we did last year for the 15 million. And Tracy was lifting that up as a focal point that she thought was very important. And Brenda was acknowledging how we did some of that work last year and Men and Women of Purpose were involved in that. But she didn't
That-
remember which subcommittee it was. Yeah.
No, yes, that is correct. They all of the CBOs came last year, and minimum purpose was one of them, which helped us kind of crack down for the focal point of the access funds, as well as tying in the information from the surveys for policy from programs and services, as well as in custody. So, all of them did come and present, and all that stuff is in like all of their all of the handouts from last year. Was there a
And so
question
when
about them or?
No, we were just discussing the,
You know, the financial reports.
yeah,
That's
our
that's-
work- our
that
work
was the
plan.
question we were.
Yeah.
So is it a quarterly? Do they quarterly report to anyone?
Well, yeah,
Financial-
RJ does their own reporting. So RJ, technically we do have them come and do, you know, presentations about what they do. But RJ, for anyone that is funded through this money, Office of Reentry and Justice do I don't know how often it is, but they have to report certain data and outcomes to them in reference to the RFP that they were granted. So we haven't seen that. I myself have never asked for it, so I'm not going to say that you can't. I don't know. That's a Patrice question, but I know that Office of Reentry and Justice, they do get data from all of the CBOs regarding the funding that was allocated. Did they meet their benchmarks and what the RFP said? But that has not been something that us as CAB we've looked at.
And is that with that, with Resource Administrator's Office, is it like, is that part of the audit?
I couldn't hear you. The first part cut off.
I think it's the RAO, Resource Administrator's Office. There's a third party that does a review of that evaluates the programs and services from that proposal. Is that who you're referring to?
Well, and Garyana,
Support.
you can correct me if I'm wrong. I know that well, so I'll let Garyana ask that. I know they came in and they did the what was it called? The thing we did at in Richmond, restorative justice circles. They collected some. I'm not sure on how often that RJ uses them. So Gary, I don't know if you're sure if they use that consulting company to do the data collecting. I thought RJ does it. That's what their QA, their staff that they currently have is the one. That's what I thought, but I'll let Garyana correct me if I'm wrong.
Yeah, Tracy, what does it say? Because I know we use RDA consulting services, but that's for the evaluation of the quality of services amongst our CBO partners. Is that what you're referring to?
Yeah, do we get a report from them? Like, is there a more recent report from them?
So we just completed our site monitoring evaluations of our CBO partners. We're trying to find ways to make this information accessible to the public. And so we're trying to figure out how to present this information because we don't want to share like all of the findings, but we do want the public to be aware of what's going on with our CBO partners. So that's just in the works.
And I think Patrice said you guys are working on a dashboard, right? Like,
Yeah, we're
okay.
also working on an interface, a public facing dashboard that you can access through our ORJ website. That's also in the works.
So the most that we get right now is just the results in July in reference to like gaps and feedback from the community partner surveys, right?
Yeah, and I know they report quarterly. I'm not sure what's the full data, so I can ask Kimmy on that. But programs and services are looking at their AB 109 quarterly data to make targeted questions for their site visits. So I could share that with this subcommittee if that seems helpful.
I think we were just saying high level, how we were measuring the performance. So as long as we know that there is something in place.
Yeah, and I think building off of that, Tracy, the reason I incorporated that R&D example is because it's so historical, right? Like, I think it's a really great document and it goes in depth, but I don't think ORJ and CAB have collaborated in order to do something like that since. And I think it's something I would like to push our subcommittee to think about, if not this year, then next year. How do we set that infrastructure up to replicate that? Because I think the ORJ does a great job of monitoring the CBOs, but there's then that disconnect across the county departments because they're not being evaluated in a public space. So then thinking through this, it doesn't sound like we have too many changes and this is a living document, so we can always incorporate changes as we move through the year. I think what would be helpful for me today is to do that second column, the timeline, and start to think about when we might want to invite some of these organizations or departments into this space. So that way ORJ can help to schedule and facilitate that. So when you're,
I just have a question about that. Since we did just invite these CBOs to the space last year and they provided like information, did we do anything with that information?
Yeah, so that's what informed the excess fund recommendation.
Okay.
And so I think what we can do, so that way we're not reiterating information because their needs probably haven't changed in 6 months significantly, is talk to them about their experience reading the recommendations and if it aligns with what they vocalized, and if there are gaps outside of that, they'd like to see us prioritize as well. Almost collecting living feedback or ongoing feedback. So then when we're thinking through these, I think there's about 6 rows. Which ones stand out as things that we should start earlier in the year? And what are some things that we can wait until later in the year?
I think probably the first one is review the previous evaluations and policy and budget recommendations. That should be probably one of our first things that we want to look at. Now, time-wise, this March, April, May. I mean, how long do you think we need to?
Yeah,
do
a
that?
couple meetings. So
No?
yeah,
Maybe mid-May, maybe?
so maybe March through May, something like that. And that second bullet point, maybe we can invite departments
Yeah.
in summer, so maybe June or July.
So do we not, I mean, do we get this information from the reports that we get from CCP?
Yeah. All of that will be previous reports.
And we'll invite the departments to come in and speak about the information that they've shared with us.
I think these are a little disconnected. The first one is all about like the information that CAB has presented. So that way we get up to speed. We had talked about this subcommittee kind of doing a lot of learning in the first couple of quarters. And then the second one is really inviting the departments to talk about their status with the $15 million recommendations. So they're a little disconnected. I think the first one is like that base layer, and then the second kind of adds on top of that, if that makes sense. And then for that second row, I think that's similar to the first one. It's that base layer of understanding. So I think over the next few meetings, we'll go through different components and kind of learn and educate ourselves on that.
And so going back to the departments,
Yeah.
historically, has the departments came to the CAB meetings to present?
I don't know, historically, last year they did because there was dollars on the table.
Got it.
And so they were excited to engage and have conversations with us. I don't know if that's something that was ongoing in previous CABs. Yeah, Nicole. Just can't help yourself.
No, well, no, because I don't want. Anyway, when we say departments, are we referring to CBOs or the county departments? Which departments?
County departments.
Okay. So the reason why I raised my hand, because before, I know you guys are working on a timeline, so just gentle feedback. I know that some of the RFPs are still in place that Patrice and them are working on. Not all of the departments may have an update, so there may be some, may want to kind of follow up with Patrice, kind of figure out where they are, like for that EHSD, that's kind of like way out there because of Marauder's working on that. I know H3, they're kind of, in my opinion, like the farthest along because they just now finished their RFP. So I give you an update on that. They have made decisions on who's going to get funding for that. Patrice is still working on the GI part of it. We still have to work on the employment part. So some of them departments, I know I don't know where behavioral health is, but some of them departments may not have an update yet to bring to you. So I think, and they suggest you can take it and fly with it how you may. It's probably kind of figuring out from ORJ where we are first and then figuring out who's ready. H3 maybe if you were trying to schedule one, maybe the first one. I know that they just gave their recommendations to what is it called? Family and Human Services. And then that's going to go to the Board of Supervisors for the final okay. And then that information will come out on not just who are all the individuals that was funded through that MeasUreX funding, including the housing funding that we recommended through our AB 109 Access Fund. So that's going to be the first one that comes out. But we left with pending an update on everything else.
Yeah, that's great feedback. So maybe we broaden that and it can start in June and just continue throughout the rest of the year as RJ understands where different departments are at with their RFPs. That's great feedback. Thank you.
So we can look at this in June.
Yeah, starting in
June.
June
Okay.
and then throughout the rest of the year. This third row, I'm really interested in this. And I don't know if this is a personal interest or if you guys align, if the subcommittee aligns with this. But when Patrice was talking about the discretionary funding awards from the state at Retreat, it really sparked an interest for me. And so I would love to prioritize inviting or trying to invite someone into this space to educate us on this. And would love to do that earlier in the year, but I wanted to feel it out from you guys. The alignment, the interest was aligned, or if this is just like a personal thing that I need to go spend my own time on.
I mean, I like the idea simply because it was tied to getting more money, and
Yeah.
the more money we can get, the better. I mean, I'm interested in knowing as well.
Right.
Knowledge is power.
Yes. So then, Gariana, as we continue to update this work plan, I think one of the takeaways for next month would be to have ORJ understand who could they invite into this space to have a conversation about this, and then maybe try to get that onto the books for either April or May, depending on which department and who that person is. Awesome. Cool. So then we're skipping down to goal 2, row 4, review CBO needs as highlighted in the survey results. This isn't going to be until later in the year. So I think we can put August and September here. We have review quarterly financial reporting, and we're going to add a bullet point, thank you, Tracy, to ensure that CCP is actually doing this. Examine previous year spending. Savings that could be reallocated. Yeah, so I think this also kind of is ongoing almost. I think there's gonna be components that we start to explore now, but it'll be work that we carry through the rest of the year.
Mhm.
I'm just gonna put ongoing for that one.
Okay.
And then the last one, inviting CBOs and community members,
Yes.
I think that's throughout as well. I
Yes, that's-
would really like to prioritize that kind of baseline education before we're inviting people into this space. That way we come prepared with questions and actually know what we want to get out of hosting them. So maybe this can start in like June, July, August,
This one is.
yeah,
okay.
as well. That's all. I know we're doing this verbally. I'm sorry we can't do this on a shared
I know.
document here.
Okay.
But how is all of that
That makes-
feeling?
okay.
I can make these changes and we can bring it back next month and maybe walk through it again. Find, like, change any small details.
It's for me. Garyana, is it possible for us to have a copy of the county's most current AB 109 operational plan? Because I think that it's important to make sure that we're in alignment with that, right? So,
Yeah.
and I
Say
couldn't find
the-
it.
Say the document that you want us
Is it-
to,
The AB 109 operational plan.
Yeah.
But
Sorry,
Annual
my,
plan, correct.
my thing was moving slow here. Yes, we can provide that to you. There hasn't been an update, I'll be honest, for this past year. Because typically we submit it to the BSCC, which is the California State Board of State and Community Corrections, in order to retrieve or be in compliance with receiving funding allocations. There was, this last go round, there was a recommendation that we submit, but there wasn't a specified deadline because we weren't anticipating, or the state knew it wasn't giving out any new additional monies. So this one last year will be the 1 year off where there's no updates, but I can provide the prior year.
But otherwise, our work plan is in alignment with that. I guess that is what I was concerned about.
I'm sorry, I didn't hear you. Say that again.
Work plan, like the policy and budget work plan. When I was going through the documents, there was some concern about the county's AB 109 document. So that's why I just wanted to make sure that our plan was in alignment with that one.
Got it.
Jace will keep us in.
Okay, okay. But no, I like it. Otherwise, no, this is good. I like details. It's detailed. It's not so high level.
Awesome.
It has actionable items.
Great. All right, any other feedback on the work plan? Great, so I can, I'll update this and I'll send it to, ORJ. I think Ariana, you could disseminate that out, just to ensure we're all aligned. And then if you can respond back to her that you guys
Got it.
feel like it's good, or if there's any
Okay.
changes.
Okay.
And then we can incorporate it into next month's agenda just for final approval. And then we can continue to update it with our work to date so we can share it to the larger body. Awesome. Any public comments? And again, apology public that we didn't have the document to share. It will be available next month. All right, we're just moving along. So kind of want to, I want to blend number 5 and 6. So number 5 and 6 were incorporated in today's agenda packet as a learning opportunity. Since you're both new to the subcommittee, we wanted to present some historical document and give you context on what we've been working on over the past couple of years. So if you go to page 11 in the packet, this is the policy and budget recommendation for fiscal year 24-25. So this was completed during fiscal year 23-24. So this is what this subcommittee worked on in collaboration with programs and services and the recommendations that we brought forward to CCP. This recommendation didn't fluctuate much from fiscal year 23-24. We heard pretty consistently there needs to be an investment in housing, in behavioral health. We need to come in with a specific lens to the populations that were being served, and so on and so forth. So we took this as kind of the starting ground of how we would learn about where we want to invest for the $15 million excess funds. And so we invited CBOs and departments from the county into this space to talk about these specific recommendations, how their work aligns with it, and where they think ongoing gaps are that could be funded in order to overcome some of these barriers that these populations are facing in these spaces. And so then if you skip ahead to page 21 through 28, there's a summary on page 28, which is a little bit more consumable, is the actual budget recommendations with high level markers of what we wanted to invest in. And so I hope that you got an opportunity to review some of this in advance of today. But again, this was kind of just that baseline learning. If you go back to, and I'm jumping all over the place, Ariana, I appreciate your flexibility. Where is it? Page 17, you'll see the fiscal year 25-26 policy and budget recommendation is very short and sweet, right? Because we didn't need to reproduce all this information when we just made this large recommendation of how we think the county should invest. And so we created a really succinct letter that directs the narrative to the recommendations that we had provided earlier in the year. So I'll pause there because that was a lot of information. Nicole, I also invite you and Patrice into this space to add on or provide any insight that would be helpful. Yeah, so then I invite it to the subcommittee. What are some feelings and questions and thoughts, and what are some things that you want to poke holes in so we can make it better as we move forward?
Now, this was just for the 15, right?
Correct.
Yeah.
Yeah, and
This
so
one I'm
it's
very familiar with because we've gone over this a couple of
several times, yeah. And it's not something that we'll do again. So there is an excess funds right now. So we're now thinking, one, how do we continue to track this and ensure that it's being spent the way that we recommend it? And also going back to our larger stable AB 109 CCP budget, how do we ensure that spending is aligned with what we're hearing here and what we're advocating for in this space? Again, this is a lot of new information, so I understand.
Justin, can I jump in? I don't
Yeah,
wanna-
please.
So no, I just wanted to piggyback off of what Justin was saying, that this is it's a lot of information and it's new. Just reminding folks that we are still at the beginning of this, and what I mean is there's things in the works right now from the and I'm Patrice, tell me if my acronyms are wrong. The CIO office right now, I'm figuring out how they're going to monitor how this funding is being used through departments as well as any CBOs that have it. So some of the things that we would normally question as policy and budget. Just want to gently remind everyone that we're kind of still at the tail end of the beginning of it. So right now, as I said earlier, some of the RFPs are just now getting put in place, or we're still working on a few things. So the monitoring hasn't really started. Policy and budget on their side, they'll be doing some things as well. So I think it's getting the idea and just feedback of, like you said, Justin, how we want to do it. Like, since we know that we're in the implementation phase of starting this, when everything really gets up and running, asking those questions for confirmation, exactly what you just said. Who's going to monitor it? How's it going to be monitored? How do we know that's meeting them benchmarks? So again, the beginning of this year is putting everything in place because it hasn't been, although we allocated it, it's not all in place yet. So there really isn't anything to monitor yet. And it's going to be some time before we even get there. So I did want to point that out as you read through that is everything went through, but RJ is working really hard right now and getting RFPs out, working with departments, researching stuff. So they're like, it said we're now in that like implementation kind of phase of everything.
Awesome. Thank you, Nicole. Is there anything that stood out to you that you're like, this is surprising? All
Well, not for me, because a lot of the things that you were stating,
yeah.
when we did our ambassador meetings, these were a lot of the things that we kept bringing up.
Yeah.
And what I felt good about was that at least the people that I've talked to, they were well aware of what CAB was doing. They were in line with what CAB was doing. So, they were impressed, and they wanted to be, to keep them in the loop so that they know that we know that they're doing their job. And I thought that was pretty good, I mean, well, that was one of the supervisors, that's what he said. So the sheriff's department, they're okay. I mean, like he said, he told me, he said, I'm in the business of once they've committed a crime, okay? But he realized that their mindset needs to change. And so I was really impressed with that. So a lot of this stuff, I know about it high level, not being, involved because of all the meetings that we went to. And I went to a lot of the CCP meetings, listening to them, discussing the budget, and how things were going to come and go. So I feel pretty good about it because, like I said, at least I was intelligent enough to realize that I needed to go to hear these meetings so that I would understand, what they were talking about. So CCP is, yeah, they're on top of everything. They really know what's going on. Our question is how are we going to know with our monitoring that they're giving us the information that we really want? So we're going to have to really be on top of it because they may just throw information to us, but is it really helpful to us? Because, some people like to throw out numbers, and I want to know what's behind that number. Okay, and so that's one thing that I have a question, but this, yeah, I'm very familiar with the 15 million. My question is, once this 15 million has been allocated, what is going to happen once that period is over? And are we still going to follow, this, but we need to know, or we're asking, all right, this is your budget, and do we have the right to ask that information? That was the question that I had. Do we have the right to ask that question about their budget? So, I don't know. I don't know what to tell you,
Yeah, and I think
Yeah.
feel free to add more context or clarity to the work plan. I think we're trying to create a process here where we can start to ask those questions
Questions, yeah.
or figure out what questions we're able to ask.
Right,
Yeah,
yeah.
that's great.
Yeah.
Tracy. You're quiet on this one.
Oh, no. It's so odd.
Yeah.
I mean, I should say I'm shocked, but I'm not.
Yeah.
But for us to allocate money for programming and there's no movement in it is a little concerning, but.
I'll say that again. I'm sorry. What you said, you're not surprised by?
We've allocated money for things and we don't have the things that we've allocated the money for.
Oh, I see what you're saying. Gotcha.
Yeah.
Do we have timelines on these things or?
That would be helpful. Maybe that's the ask, Ariana and Patrice, is if we could get, similar to what Nicole was calling out, what information to date we have about the status of different RFPs and different departments related to this excess funding. So is that something we have now, or is that something that could be kind of compiled?
Yeah, we can certainly compile it so that way it's written and you can kind of see across the different areas where, what sort of the status of where things are. I think like Nicole mentioned, H3 I do know is the furthest ahead. They've already ran their RFPs. They may have made selections already, I'm not quite sure, but that's certainly something we can bring back. And then the reentry core team has already been operational. That's been going on. I can't remember the exact date of launch, but it was toward the end of last year, I believe. So they've been actively serving clients to date, which is huge. And then later we'll go into the scopes of works for the other one-time services that will be administered through our office that are related to the pre and post-release area of focus. So I would at least say that I guess what is outstanding is probably the county employment pathway and behavioral health. Their what was it, mobile behavioral health services.
And do we know what the holdup is with the county employment pathway?
I don't at this moment. And I'm sorry, there's also the guaranteed income. There is a timeline for that one. That is, keep in mind with that particular process, it's in alignment with, or it's kind of going through its own timeline based on what the Board of Supervisors has set, because there are a number of, it's a larger countywide guaranteed income project that's going to focus on 4 populations to include the reentry population, which is one of their target groups. So they are still, EHSD is still in the process of developing the final proposal that they would then present to the Board of Supervisors, I believe in either May or June, to get their sort of approval to move forward. And that is going to be blended funding with AB 109 resources and Measure X funding.
Yeah, and I think kind of just to, thank you, Patrice, that's really helpful, to kind of summarize that a little bit. So if you were to look at this housing, that 7.5 million or $7.4 million, all of this is RFP'd out. So it's either on its way to be contracting or is, you know, several or very close to be. And then if you were to look down to like the core team is another $500,000. This is already implemented. You look at the budget, the departmental budget modifications, that's almost $1 million. Those are all already in implementation. So I think there's components, if we were to like pull this apart, I think there are components that are moving, and then there are some that we need to follow up on. And the bottom one is the one I'm really curious about, the CBO training and project support, because we just gave a little bit of funding and some guidance, but we didn't give real tangible details about what we think the county should spend this money on. And so I'm sure that's going to take them some time to iterate internally and come back to us. So I think there are, to your point, Tracy, like there are components of this that we should dive a little bit deeper and ensure that the timeline is not, you know, 7 years down the line or something, or the money just gets pulled into something else. So I appreciate you raising that up. So maybe I think the recommendation here from the subcommittee, Gariana, is if we could almost utilize this structure of the budget and to the right of it have a little update of where the status of each of these or the projected status would be really helpful. We don't need something super detailed. I think cut and dry would be helpful. Thank you. And please push back. Like if some of this is the subcommittee's responsibility, we're happy to do work. So Patrice, we heard that you're digging into previous recommendations and the how much the county has already adopted and continues to utilize versus things that might have fallen through the cracks over the years. And we thought we were going to be working on that. So thank you for taking the first stab at that. We appreciate it. Awesome. Great. Any other questions on the previous recommendations from the last 2 fiscal years and the 15 billion? Hearing none. Any from the public?
Of course I do.
Great.
It's really not a question. I'm just excited, and Patrice already said it about the core team, and I don't want to ask something that they can't do, but is there something that we can probably share with policy on budget on what they've done so far, or see if somebody can come and give some information, because it's amazing at the work that they have done so far, that I think that you all will be like excited about you know, with your recommendation that you made, the work that's being done and how many people it's touched. So I'm just very excited about that.
Yeah, I think it's probably best we invite them to, I don't know if it should be specifically to policy and budget or to a future full cab meeting where they can probably provide a full presentation on services to date and for core, and then also sort of status update on their RFPs. So we can put that request in and see what's a good time frame for them. But you guys can let us know if you prefer to be at the subcommittee level first and or if you prefer it go into a full cap meeting.
I think that'd be great at full cap.
Yeah,
Okay.
full
Yeah.
cab. Full cab.
Cool. Hearing no more public comment, we can move to agenda item number 7 to discuss the scope of work. Patrice, I think we'll pass this to you. If that's okay.
Yes, okay. So we have been busy in ORJ, trying to compile a number of different scopes of works for 3 service areas. One for the gender responsive services and transportation services with peer support, which was encompassed in your recommendations for pre to post release engagement. And then separately, we have the Local Innovation Fund, which has a pretty significant, or I would say a sizable fund balance as well, that we are prepared to release an RFP for that also, and we want to get you guys' feedback on that. So just want to pull up on my end. So if we can, let's go to the very first one. I have these in sort of a table format. These are very rough drafts, so we wanted to present this to you to get some of your feedback, make sure we are capturing at least the key program elements that you would like to see be included in these respective service areas. So, okay. So for what we're calling the West to East Transportation and Peer Outreach Services, you know, the goal of this, based on you all's recommendation, was to really provide an opportunity to have transportation be made available to folks who are either released from jail to then connect with community programs, and or also having transportation connections when they're already engaged in services, right? So when folks are already out in the community. The priority population here would be our AB 109 tiered pop and individuals exiting our county jail facilities. The service model would likely contain shuttle services, and we are largely pulling from the suggested scope of work from Santa Clara County. They released an RFP. We did identify that as a reference in your original recommendations there. So, and I believe we have it attached in this agenda, their scope of work that was included actually in the contract of the provider that they're working with. Okay, yeah, there it is. What page is that? That's page 38 of your packet. But if you can go back to the table, Gary. And so the shuttle services is pretty cut and dry. It would be Monday through Friday, 8 hours a day, with some specific identified or designated locations for pickup and drop off. Potentially those drop offs would include county service buildings, as well as our AB 109 CBO providers. And again, you can reference the scope of work for Santa Clara's transportation services. In addition to the transportation itself, we wanted to connect this service to, or at least have involved in this service, peer outreach personnel who would serve as sort of that dispatch kind of coordination and connection to individuals as they are either exiting the county jails or trying to get connected to the services that are available out in community. And the original goal was for this sort of peer outreach team to fill in the gap where we're hearing there's a significant drop off from the time that someone is in custody, receiving pre-release planning, and then referrals are made out to different programs. And within that initial 2-week window or what have you, just a complete gap, is a complete drop off. So the idea was that this team would have a a caseload that they're not working with them long term, just within those critical first few weeks. In some cases could be further months, especially if they are waiting for a housing slot outside of shelter. That way that there is this sort of field-based coordinated group that is ensuring that the client is in fact having regular connection and check-in and taking full advantage and engaging in the programs that are made available to them. Let's see, if you scroll further down, you'll see a little diagram where we are trying to demonstrate how this would work. So for jail releases, transportation can be provided directly to shelter or some kind of interim housing placement, or from jail to a reentry program, such as any of our reentry service hubs. There's also an opportunity for transportation to be made available outside of or from the shelter or interim housing placement to those other designated locations. And then it would be continuous once they are actively engaged or active clients of those community programs. We didn't want to, as we're thinking through this, we wanted to be sure that this isn't running in conflict with what CORE is doing, because they are also responding to referrals and calls for individuals who are in the jails to get them intaked, assessed, so that they are in the queue of the COC system and all of the relevant housing opportunities that they may very well be available to utilize. So we would have to make sure that they're working in concert with CORE, not in competition or any conflict there. But again, the core essence, not in terms of CORE, the team, the core essence of this service would be so that transportation is readily available to the programs that we're essentially funding and to those county services that are available. And that is actually outside of the scope, to my understanding, of what CORE typically does. So CORE is really transporting folks to housing placement, and then they move on to the next call, so to speak. But whereas this team is helping to support program engagement with the programs, with the reentry programs that are made available in the county. Okay, so the funding allocation for this is $450,000. Initially, you guys recommended that it'll be over the course of 3 years. After looking at Santa Clara's process, they are providing this same amount of funding, but actually for 2 years. So that would mean if we stretched it out over 3 years, you'll have less, a provider will have less funding to work with annually. So that's something we wanted to bring to your attention. And in terms of how we would roll this out, this would be project specific, where we could potentially offer some extra points or extra credits for any applicant that applies for this service, and they are demonstrating some level of collaboration or have other resources that they can leverage to make this a very robust service offering. We're also stating that, then here we have a listing of some considerations that should be taken into account. I think I already shared earlier that, consider reducing the contract term by 1 year. So instead of 3 years, make it 2 years. And then due to one-time funding, we may want to consider requiring applicants to develop a sustainability plan on how they wish to continue services or seeking funding once the contract term is over, given that these are one-time pilots. So that's kind of it in a nutshell for the transportation services with some peer support. I can run down through the others as well, or I can pause here to see if folks have some initial reactions, questions, or comments.
Yeah,
How would you
Patrice,
guys
thank
like
I
to
think it would be
proceed?
helpful to do it one by one if we can.
Okay,
I'll open up to the subcommittee members for, I have my own thoughts and questions, but would love to hear.
Sure, thank you for this information, Patrice, it was helpful. I don't have any background on this project. Was this something that CAB created? Or
Yeah, this is
recommended?
part of the $15 million
Okay.
excess funds.
Okay,
So there was a identification of a gap of just overall wraparound transportation services. So there was the core team who's responding when
Right.
someone is being released, but then getting them continuously connected to supportive services is a challenge.
okay.
Great question.
If you want a 9 tiered population, what is the tiered population?
Patrice, what's
so the
tiered
tier. Should I respond?
Yeah, please.
Okay, so, gosh, this may have taken place back in 2013 or 2014, where the county approved to expand the eligibility for individuals, justice involved individuals who would receive any AB 109 funded services to a number of different scenarios or instances where an individual touches the justice system. So instead of specifically only serving AB 109 probationers, it was expanded to include general supervision clients, anyone that's on pretrial, parole, informal probation, which is essentially court probation, anyone that might be connected to any of our specialty courts. So that might be a behavioral health court or veterans court. Some others are escaping me right now, but anyway, so it's considered a tiered, expanded eligibility criteria. And the stipulation there is only if contracted CBO providers have the capacity to serve beyond AB 109 probationers, they are welcome to do so. So often we do see of all of our primary AB 109 community programs, most are able to service more than just those AB 109 probationers, with the exception of housing. Housing is typically very limited. And so the priority participant in that regard would be AB 109 probationers, which is essentially why you all advocated for increased funding using these one-time funds to expand housing options so that more folks could be served. So that's what we mean by the AB 109 tier group.
Yeah, Patrice, I think I align. I think this is great. I think it encompasses the majority of what we were designing to do. I love that the arrows go one way, and I'm used to these like circling back around, and we don't want them to go back to jail. So thank you for that. Couple of things to call out. Can we be explicit that they don't leverage like ride share companies, that this is a curated in like response, or like they're using their cars and there's someone who is trauma informed and has a background in this work that's actually picking this individual up. So it's not just some random car that costs the county a crap ton of money. And then the second thing I would advocate, I see you trying to reduce the time frame to 2 years based on Santa Clara's. I would recommend trying to do it over 3 years, or saying 2 years with the option for a third, because we don't have any data to support how many people need to utilize this service. And I would be discouraged if we were limited to a 2-year contract and we underspend, and then that money goes back to a general fund or some other type of resource.
Can you repeat again your initial comment about if they were to do ride share? Or was it a
I
little
mean,
bit of both, whether it's
yeah.
shuttle or ride share?
I would advocate to not utilize rideshare at all if possible. I don't know how the rest of the subcommittee feels or the public, but I think if we can create an environment where that person is almost getting their hand held through this process as much as possible, I think that was kind of the designation behind this recommendation. How you
Yeah,
all
if
feel.
that's the interest of everyone, we can certainly be explicit about not allowing ride share here.
Here.
Well, I wasn't here when this was created. I personally think that this is a lot of money to donate for rides for someone, and I would probably be more open to just ride sharing, but I understand that to kind of hold their hand through the process and more of a warm handoff versus
Here you go.
we're just providing transportation so you can take advantage of these services. And I'll also have to do some additional research on my own to learn more about CORE and what their transportation covers. So, but otherwise, yeah, just.
Who's gonna develop this shuttle service? Is it gonna be a county shuttle service? Is it gonna be a a personal, like the city of Richmond now has these Richmond rides where they have a system where you can actually get service for like $2 or $3. But it's only for the city of Richmond. They will not take you outside of the city of Richmond. So that's what I'm asking. Who's setting up the shuttle service? Is it gonna be through the county? Is it gonna be through what, a private company? How will we know
They want to RFP it.
who's setting up the shuttle
Yeah.
service?
So we would solicit for responses from any agency that's able to do this, whether that's private or nonprofit. It wouldn't be county, wouldn't be like county vehicles and county staff that would run it. We would outsource that to a different entity.
Thoughts and feedback before we go to the public?
We have to say this. It's like, you throw this at us and it's like, do I have a question? Well, I'm ready to over through yet. I'm not sure if I have a question. So.
What's your timeline
Yes,
for
and then
rolling
yeah.
the RFP out?
So we were hoping to get it out by early April, but even our own timeline is having to get pushed back a little bit. But the goal is to have it out by this spring. So that way we can, we're hearing you, we're trying to get these services out as quickly as we can.
Great. I will open it up to public comment, Nicole.
Yeah, no, I was adding some context to what Tracy had said, because she brought up a very important response in reference to the money that's been allocated to it and the amount. So we did do a few different work groups within the county to have our current county programs come that are providing some sort of a level of transportation like rideshare and things like that. And what we came to find out is there is a significant gap in dislink from individuals that are being released from county. In the past, there used to be like transportations where you would take them to their next destination if they were to meet with a CBO, like in one of our funded CBOs, to make sure it's that warm handoff. So we're losing individuals from the time of release to that next step. So that's the reason for this allocation for the funding, to try to remove that gap and tighten up the service to ensure the person can get there. Some of the feedback that we got from surveys from individuals is missing like that hand holding, missing that support, missing feeling like someone is connecting them to the services. So it's something that we had like a while ago that we kind of wanted to bring back to just ensure that along with what's currently there, like the jails may give them bus and BART tickets, or some of our providers do have that funding to be able to pick up somebody or do a ride share, but it's dependent upon enrollment. Like there's some things in place, so this one overlap with that. So there's a small amount of individuals that are not getting that service, if that makes sense. So this number and the outcome from this was pulled from survey data, the presentations from our CBOs, and information that we collect to identify that gap that was there. I hope that was helpful.
It was, thank you.
You're welcome.
Any other comments from the public or feedback on the RFP from the public?
Awesome, thank you.
Patrice, if we have ongoing comments as we review this, are we able to share that with you directly?
Yes, feel free to send them my way.
Awesome, thank you.
We're ready to move to the next one.
Okay, so the next service area that we're looking at here is for pre to post release gender responsive pilot program. This would be to provide holistic wraparound services to women exiting our county jails and other justice involved women in the community for a period of 3 years. We did, and I think it's also attached to this, to your agenda packet. We tried to do a scan of some best practices and approaches to providing a gender responsive programming for justice involved women. And so a lot of this is largely pulled from the Council of State Governments Justice Center, who has a resource guide specifically on this work. It's really, I would encourage you, this is certainly an area of interest or a passion of yours. I'd encourage you to review that guide, because it also includes a listing of evidence-based program models for providing gender responsive services, particularly for women. So here, the priority population that we're proposing will obviously be a female jail population in our county jails, and then those justice involved women in the community ages 18 and over, very likely to be that part of that tiered eligibility group. We are recommending that this service be a comprehensive program that incorporates evidence-based practices and some program elements. Specifically, we want to see the utilization of a gender responsive risk needs assessment. That way, providers are utilizing a validated tool that is taking into account the unique experiences of women who are involved in the justice system. We're looking to also have gender responsive case management that would incorporate certain practices that are gender responsive in nature. And that they are working, that case managers are working with women while they're in custody for a period of time, immediately following release, and then a phased approach over time as they're getting connected to services. We're also recommending that as part of this program, there be an incorporation of cognitive behavioral interventions that are also gender responsive. So that way, issues related to trauma or behavioral health challenges are incorporated in the case management and in the delivery of the service, and that's something that would be a core element that women in this particular program would undergo. And then lastly would be a category of that's connected to all of this would be a category of providing wraparound services for women. So this would be sort of a listing of service areas, either that can be built out by the potential applicant or provider of this service, or that they would refer out to. And this would include really to emphasize a holistic approach. So gender specific mentorship, some life skills development, career pathways that would be most suitable for justice involved women, education opportunities, housing assistance for families with children, childcare assistance, which we haven't really seen that much of in a lot of our programming in the past, substance use disorder outpatient treatment, family counseling and therapeutic services, and family engagement and support, which is separate from what we would consider being family counseling, just allowing space for women with children or with their loved ones to build rapport and relationship through healthy, positive activities, family welfare and child custody advocacy, and any restorative justice offerings. So we're recommending this as the scope of work for a very robust and comprehensive gender responsive program. We have sent this over to the sheriff's office in hopes of getting some feedback from them, because as you will see, that the in custody element of this is not very specific. And we wanted to take into account the operations of the jail, what is likely to come with the expansion of West County detention facility, which would allow for more programming space. So hopefully with the feedback from Sheriff's Office, we can also incorporate where there's space for more gender responsive in custody programming. The funding allocated for this service would be 1.25 million over the course of 3 years. And I've listed here a couple of options for how we could set up this particular RFP. We can make a requirement for collaboration if we wish to see multiple agencies working with this population. Keep in mind, women in our county jails, or really West County, it's a fairly small population, but nonetheless, it does require intensive programming to pull off this sort of wraparound support. So here we are providing 2 options of how we can go about this. Option 1 would be a collaboration requirement where an applicant would be a lead agency and have sub-partners or subcontractors where a portion of this funding would pass through to them to provide a variety of resources. This would, if we go that route, that would mean we would only provide 1 award for this program. And then we would require a minimum of 20% of the funds be allocated toward project evaluation. So this would be an instance where we would have the actual applicant identify its own evaluator to conduct the evaluation of their pilot. The other option would be just to make it project specific with some extra points for collaboration. We like to encourage collaboration because often what we see in our solicitation or in the response to our solicitations over the years is that you have the big fish, if you will, in the small pond, who often have great grant writers and know this work like the back of their hand. And then you have emerging organizations who are looking for a shot, who are doing some incredible work, but maybe they're not as skilled or are still lacking some of the nuances to be able to be competitive in a county procurement process. So we like to create as much of an open, wide pool as possible. We've had even providers from other counties take interest in coming into Contra Costa to do some of the work because they're hearing about our values and our intentions in providing some of these services. But I say all that to say that we can certainly be savvy about who are the type of providers we want to see take full advantage of these resources, which is why we have these options available to you. So some considerations to think about is that we want to consider incentivizing the use of leverage resources. Again, that's another thing we are big on working smarter, not harder. And so where there are resources, because these resources are finite, where there are opportunities to leverage, we want to encourage that, especially around the array of service offerings that we'd like to see through this particular program model for those various wraparound services. Another consideration to take into account is that the program design should demonstrate continuum of support and care coordination for women from in custody to post-release. So we really want to emphasize that through this particular project and not have it be just either community or either in custody, that it can span across the experience of an individual from custody to in community. And then due to one-time funding allocation, so sorry, I don't even know how to send this to. Okay. Due to one-time funding allocations, applicants may be required to develop a sustainability plan. So I shared this before in the previous scope of work, and we'll include that here, that we would want to see, likely see from folks, how they plan to, or what funding they look to go after, or how they plan to sustain this work past the contract term. So that's it in a nutshell. Happy to take your reactions, your feedback, questions, thoughts, concerns.
Spend time reading this, going over this. Especially this resource guide was very interesting. You know, for women. That's it. Something that you part of it, yeah. Adopting a gender responsive approach. Resource guide. I'll be spending time reading that. I can understand everything.
Patrice, I think my initial feedback is leaning towards option 2, but I appreciate the lens of trying to allow a pathway for smaller and more, for lack of a better word, like infant organizations or growing organizations into this process. I think the county fails to do that over and over again. And so I just don't know if the option 1 really addresses that, because my mind goes to a indirect cost rate of 10 or 15%. And so you're talking about $125,000 that goes directly to a lead agency instead of the population we're trying to serve. And so while we're creating a pathway for these smaller organizations, we're also disinvesting in the services on the table. So that concerns me a bit. I don't know if I have an answer. I think I'm just speaking out loud. And then the second component of the 20% towards project evaluation is more than $250,000 just seems very high. I know we want to prove what's working and what might not be working in this space, and this is an opportunity to utilize funds to do that. I just think that percentage might be quite large based on the scale and scope of services. Questions, comments?
Yeah, I just say that I agree. I think 20% is a lot, and we want to make sure that we're actually getting these dollars to the people who actually need them. But I do appreciate the effort in trying to give an opportunity for other organizations to do the work as well. But that's a lot.
Is there something that we could discuss that would help you lean one way or the other, Patrice?
In regards to the options here,
Do you have a preference?
if you were responding to my question, I didn't hear you.
Oh, I said correct. That's correct.
Oh, yeah. No, I don't think we have we don't have a preference one way or the other. We just wanted to provide this to you to see if this was of interest to you. But if you all feel that option two is best fit for this, given, as you said, the scope of this and the total amount that's made available, we're more than happy to do that.
I have a question, only because the 20% is a lot. I think we all have a concern about that, but then it seems like we're forced to option two. So the 20% requirement, like, where is that coming from?
Minimum.
Well,
Right,
this is just in
minimum.
response, this was in response to some initial conversations we heard from CCP about wanting to ensure that evaluation of these pilots are made available. And I want to say 20% was maybe the number thrown out there, but that was just kind of across the board of all of these different programs. So we certainly can reduce that amount. We can also look to see within our own team if we have the capacity to do this evaluation, because we'll be doing we'll be evaluating all the other AB 109 programs. So I can check in to see our own workload, if we can just take that on, so that way more dollars are to the provider to provide the services. Ultimately here, we do want to make sure that some evaluation is done on these pilots, because that will come in handy, right, when it comes to finding additional resources later to continue the work.
I don't think we gave you an answer. Patrice.
Well,
It's
I will
okay.
say this, you have other considerations, leveraging resources, so.
Yeah. So if it is your recommendation that we remove that minimum 20%, I think that's what I'm hearing. 20% is too high. And whether what I can do is check back in with my team to see if this is something that we can also take on in terms of evaluating the project, in which case there will be no requirement of evaluation dollars set aside with this respective allocation. Then that saves everybody the headache there. But if that's not the case, we can certainly lower it. Is there a certain threshold that you would prefer to see be connected to this?
I think I would feel more comfortable with like 10% or less.
With
Okay.
a maximum.
Cut it in half.
A maximum.
Yeah.
Oh, you don't like that minimum word.
Right, the minimum 20%.
But if we say minimum 10%, then we have,
Okay.
we were saying, because I was thinking 10%.
A minimum of 10 or a maximum of 10? Because the minimum of 10 could still get us to. Sorry, Anna.
You don't like that word minimum, is what you're telling us, huh?
I think we're floating around 10%, Patrice.
Okay.
Period, is what
Some
you're
of us
saying.
You can
above,
say-
some of us below.
You can say 10% or 10% or less. And then here's another thing we can also do, that once we get to the contract phase, we can then establish certain contract requirements related to having an evaluation plan already established within so many days of the start of the project. So that way we're at least in the loop of how they plan to go about their evaluation. They may do it in-house. We don't know. It just depends on the quality and size of the organization that would be applying. They could do it in-house, you know. So in which case, if that is the case, we can play around with creating some flexibility in the language around the evaluation work.
I marked out the word minimum, right? Put require, and then we'll put in the 10% or less, you know. Okay.
And then Patrice, is there any like historical precedent for trying to get smaller organizations collaborating on projects like this? I know you were alluding to creating this pathway, like, has this been successful? Or are we testing something here?
Testing for the most part. We have seen where this first option came from was actually a previous project that the county was involved in. Actually, it was behavioral health through a BSCC grant, where it requires a Prop 47 grant, where it did require a lead agency and that a significant amount of the funding be passed through to other organizations, in which case it was a large organization who then also subcontracted out with smaller orgs to give them an opportunity as well. So, but that was just based on the county's planning around that. I don't think inherently providers, from my experience, think in that way. So that's why we have it here as a potential call out. Now we can still call that out without requiring it to, making it a requirement. So that way we can encourage those larger organizations who will likely apply to consider doing some subcontracting with smaller organization or emerging organizations who at least have a track record of providing some really good work in this area. I mean, that's the other thing too. They can certainly be small and have an ability to connect or have access to these resources, but they also will have to demonstrate that they can do the work.
Yeah. I think that's really helpful context. I think I align with that, and I would recommend trying to either create priority points or including X number of organizations with a revenue of less than X who provide services for more than 5 years in Contra Costa or something along those lines. I don't know the specifics of all of that, but I think I would lean more towards that. Nicole, I saw you couldn't raise your hand, but you want to chat.
No, it's okay. I'm making some notes.
Okay.
Justin, Cynthia had a question and she wasn't able to raise her hand.
Oh, great.
We can't even see Cynthia's name, so welcome, Cynthia.
Hi, thanks so much. I actually had a question about the evaluation piece of it, and I think the evaluation part is super important. I'm just curious about, because this is one-time funding, is whatever, let's just go with 10% and say that that's what you're going to land on. Is that the same expectation of folks who are getting ongoing AB 109 funding? Because I feel like as applicants are coming into this space, are we setting a standard higher for new folks who are trying to compete for the dollars that won't even get potentially ongoing funding that isn't the same expectation of folks who have the ongoing funding? Yeah, I mean, you know what I'm saying? I just want to kind of raise that question to make sure that whatever is decided around evaluation is consistent across the board for one-time funding as well as folks who might be getting the ongoing dollars. And I did like not to put more work on ORJ, but I did like the idea that Patrice raised about the capacity that ORJ might have internally to do evaluation, because I think as you are encouraging new, maybe smaller organizations to, be competitive in the space, it's unlikely they're going to be able to have internal evaluation, which means they're going to have to bring somebody on. And the 10%, which while I do support a lower amount than 20%, may not be enough to get a thorough enough evaluation. It sort of depends on what y'all are looking for, but I just kind of wanted to raise those questions and see what your thoughts were on those things.
Yeah, great questions. I think to your first question, no, we're not trying to set up a scenario where newcomers have a greater threshold in evaluation than the ongoing ones. We are taking on the work to evaluate the ongoing projects. And we feel as though that is really our responsibility, because these are regular allocations that are going to be deliberated on year to year. We look at these projects, these one-time projects, as something different because they are one time. And so we do want to set up sort of a foundation for evaluating to test what has been successful or what works, to set the provider up then for going after additional funding or having a sustainability plan, because they're able to demonstrate that their pilot is in fact working for this particular population. We thought that maybe by putting the evaluation in the hands of the actual provider, that it works a little bit more in concert with whatever sustainability planning that they want to have in the future. So a lot of that stuff could be done in-house, but I totally understand that in putting that sort of burden on them, and it could cause some hiccups, but that was essentially our thought process on that. If this program is to be a recurring or regular program, that we would certainly then take on that role of evaluating them ourselves.
Got it. That's super helpful, and I appreciate the clarification and also the thoughtfulness on how you're building this out. And I don't know the right answer on it. I think these are really good questions to grapple with, and I appreciate that the CAB and ORJ are having these conversations.
Thank you, Cynthia. I do want to be respectful of time. We are coming up on 12:30. Patrice, is there an avenue that we provide feedback directly to you for the local innovation fund, or is that something we can bring to the next meeting? Your recommendation?
Well, that one will actually be kind of quick. Do you mind if we go ahead and can folks
5
stay
minutes
a
or
little
so.
bit longer?
All right, we'll give you 5 more minutes.
Okay, I'll be quiet after two, so that way y'all can give me some feedback in 3. All right.
Thank you.
Okay. So here, the last time that RFP was released around a local innovation fund was actually prior to the pandemic. So we are finally circling back around to get some resources out. Here, the idea is to test innovative approaches to reentry, but with prioritizing certain subpopulations that are underrepresented, and to have these projects be launched and serving folks for 18 to 24-month period. You'll see here some of the priority subpopulations that we're calling out. Again, at least, the individuals still have to be justice involved and either be TAY or have young children or experiencing co-occurring disorders, on and on and on. Some of the priority program areas that we want to lift up in this RFP would be some behavioral health interventions, any strategies related to employment or workforce development, educational opportunities, entrepreneurship, family engagement and support, and restorative justice offerings. Here again, in terms of some funding options, or categories, these were largely listed in the previous scope of works. So option 1 would potentially be a collaboration requirement. Option 2 would be a project scale requirement that would allow us to fund more than one project based on scale and size of the project. And then option 3 would be just project specific, keeping it open. Some other considerations to take into account is ensuring that we limit our project designs to new services only. If to be used for expansion of existing services, it should then include an evaluative component that will compare old versus new, or what has been the change or impact with these additional resources. So that's something that can be discussed, and we welcome your feedback. And then there is a potential for duplication here of existing or planned innovative or gap filling programs, such as guaranteed income or gender responder services or TAY services. So that's something that we are mindful of, and we want to think about how do we, with language, sort of limit the possibility of duplicating potential services, since a lot of these RFPs will be running at the same time and folks will be submitting proposals in a number of different ways. And then the projects funded through these funds should be considered as test projects with no obligation of continued funding. And again, we would likely want to ask applicants to consider developing a sustainability plan. And that's it in a nutshell. Happy to hear you all's thoughts, or I'm open to receiving emails or scheduling calls if you guys want to talk about it one.
A couple quick clarifying questions, Patrice. Are you hopeful that responses will encompass all subpopulations and all program areas? Or are you envisioning that projects will like choose one or two of each and hone in?
Yeah, I would anticipate, I always am leery of any applicant that says that they can serve all populations doing all the program areas, because we know that
Yeah,
that's
yeah.
going to be incredibly difficult to do. So here, we would likely limit the number of subpopulations they are to serve. And also the specific program areas.
Thank
We
you.
would actually recommend that they not do more than, because again, we're trying to test the project design and see in what way, if they are looking to integrate, let's say, employment and entrepreneurship and education, well, those kind of things make sense. And so we might be open to 3 program areas being considered for the TAY population. That would make sense. But if someone is saying they want to do all 6, for LGBTQ and non-native English speaking, and also seniors, like the ability to keep track of how the services are delivered for those specific subpopulations could get a little bit, complicated. So we'll try to have some parameters established around that.
I'll lean towards option 1, 2, or 3.
I don't know. I like the idea of the preference points because it still gives everyone an opportunity to paid. And I do like giving the smaller groups an opportunity. So I think maybe preference.
One of the things that we tested at my organization, Patrice, was doing like allocation caps based on different sizes of organizations. And I think that could be something that if you're really trying to test that in the innovation space, is call out that 25 or 30% of these funds will be allocated to organizations with a revenue of less than X. And that instead of just providing preferential points, that ensures that that cohort of organizations will be involved. And I align. I think I lean more towards just preferential points instead of specific criteria.
Yeah, well, we've done something sort of similar in our juvenile justice space for some prevention funding, as well as in our restorative justice RFP. And for the evaluation panel, which usually bubbles to the top, is the project design itself, more so than the type of provider that is offering the service, right? So that's something that we have to keep in mind here is what will likely be proposed. Is it truly innovative in the way we may consider what innovation will look like in this space? And for me, it's typically what we have not yet seen be done. Because there's just such a great need. We know that for a number of these different resources to be expanded to serve more people. And so there is then the temptation to utilize innovation funds to do so. However, we want the intent of the innovation fund is to really test out an approach that we've not yet seen. And so that may include some emerging organizations, but I'm not quite certain if that in fact will be the case. We might see more seasoned folks bubbling up to the top here, because of the nuance of their project design that, the panel might want to see actually get tested out.
Do you think, can I challenge that a little bit? Like, do you think that's because they won't apply or their application won't be as competitive?
My guess is that the application may not be as competitive.
Yeah, and so I think for me, it's like, can we call out that a specific percentage of this would be awarded to emerging?
I think so. I mean, that will then at least create a separation in a way.
Correct.
Looking at.
Like, even if they're scoring 60 and the others are scoring 90, like, we're still
Yeah.
gonna move forward with a few of these emerging organizations.
Exactly.
Yeah.
Okay.
Awesome.
Any other questions, comments? I know we're way over now. I apologize. I said I was gonna be an efficient meeting master and it hasn't worked.
Hey, it has. We have.
We did do a lot today. The last agenda, any from the public, sorry, questions, comments from the public? Teresa, anything else?
Awesome. Great.
So the last agenda item is just the 30 or 40 page budget narrative that was recommended to CCP in December. Take a look through that over the next month and we'll talk about it next month, next meeting. Yeah, we don't need to include the entire printout again in the packet, Gariana. I think that we can hold ourselves accountable to either bring this back or bring back notes. But that would be a great item to include in next month's topic. Any other questions before we close and say have a great week?
Next meeting?
Oh, great. Yeah.
Next meeting.
Schedule our next
Oh, next
meeting.
meeting, oh. Isn't it on here? Usually.
We're gonna schedule them month to month because of our rotating.
Oh, okay, all right.
Did we get an update, Gariana? Did you guys try to find another date for the full cab meeting? For the month of April?
Yeah.
There's a meeting conflict with the general full cab for April.
I had a meeting conflict and I had asked if we could try to find another date, but I guess that did not happen. So it's still scheduled on the 10th. It's okay. Life goes
I have
on.
a quick question.
What works for you all for scheduling this next one?
You're talking about hours, not, oh,
Or days of the week? We'll start with that. Do Mondays work for people?
yeah, Monday's fine.
Okay. Does the 14th work?
Yes.
Could we do 11 to 12:30 again?
Okay.
14. 12:30. Okay,
Great.
all right.
Did you hear us, Gariana? Talking quietly. The 14th.
Yes, I heard April 14th. I'm just double checking to see if the room is available
Okay, great.
from 11 to 12:30.
12:30.
Yes, so if I have any conflicts, I'll reach out and we can find an alternate date or time.
Awesome. And then do you have any follow-up questions for us on next steps?
No, did you want me to repeat them?
Sure.
I will send the subcommittee the work plan for their review. It will be added to the next agenda to be finalized. Justin added a recommendation to add a status or projected status column to the AB 109 funding document. They are interested in how to evaluate county agencies, invite someone to talk about the discretionary funding, review the AB 109 operational plan to ensure it aligns with the subcommittee work plan, and I'll send that to the subcommittee for their review. Incorporate the revised CAB policy and budget subcommittee work plan in the next month's agenda. And then just making sure we have a timeline and a status for the RSPs for the different agencies. Is there something that I missed?
I think that's everything on my list. Good, Tracy? Good.
Yep, yep.
Awesome.
Yep.
That's a lot of work. Sorry, Gariana. Sorry, Patrice. Sorry, ORJ. We appreciate you and you're doing good work. Thank you everyone for the meeting. Sorry it ran over. Meeting adjourned.